had been experiencing symptoms for a while, but all of the symptoms I just dismissed as being related to pregnancy and breastfeeding. So by the time I actually went in for my diagnosis, I was diagnosed with stage 4 inflammatory breast cancer.
I had had early stage 17 years before, and I continued to follow up with mammograms and doctor's visits, and so you can imagine it just came out of nowhere.
I had no idea men could get breast cancer. No one's ever excited to hear the diagnosis you have cancer, but then when you're a man and you hear the word you have breast cancer, you have no idea that you could even possibly have that.
30% of early stage breast cancer people go on to develop metastatic breast cancer 5, 10, for me it was 12, some people it's 20 years later.
Not a day goes by that I forget that I have cancer. It's always there, and something always seems to pull me back to it. I have triggers that remind me all the time that I do have metastatic breast cancer.
I do feel like there is a disconnect between early stage breast cancer patients and people like myself living with metastatic breast cancer. And it's understandable, I have to say. If you have early stage breast cancer, you don't really want to think about someone like myself living with the disease.
No one talks about metastatic breast cancer. Everything is about early stage breast cancer. Everything around awareness is about early stage breast cancer. And women and men living with metastatic breast cancer do not feel like they're a part of the larger breast cancer community. They feel isolated.
I have a hard time when I'm talking to an early stage breast cancer survivor. I just feel like they don't really get it. They're so focused on the cure. I'm a fighter, I'm a winner, I'm a survivor, and I'm just living. I'm living with this disease.
In early stage breast cancer patients, they know their treatment's going to end at a certain point, and then they'll be considered a survivor. In metastatic disease, patients are constantly in treatment.
When you hear that breast cancer, 40,000 women a year die of breast cancer, I don't think people realize that the only people they're discussing in those numbers are people with stage 4 metastatic breast cancer.
My friends and family have attended numerous funerals for women living with metastatic disease, unfortunately. But when I talk to them about metastatic disease, they have no idea what that means.
We hear stories of survivorship. We hear stories of people being cured. We don't hear stories about people like myself living with the disease.
I had never heard the word metastatic before in my life. I didn't even know what stage 4 meant. All I knew is I'd watched these commercials of the women who ran the race with their pink ribbons, and they were done and they celebrated, and I thought I would just do chemo and be done. I didn't understand the lifelong commitment that this diagnosis entails.
We just can't, as a metastatic community, do this alone. We need all the stakeholders in the community of breast cancer to care and to address their resources.
It is important that metastatic breast cancer patients have an alliance, so they have a place to turn to, so they have a voice in the community, and they have companies that are out there willing to meet the needs of the population.
We absolutely need the Metastatic Breast Cancer Alliance. There are 150,000 U.S. people living with metastatic breast cancer. Our voices need to be heard, and if these groups can come together, that's a good thing for all of us.
We need everyone to know what metastatic breast cancer is. And rather than each individual organization working by itself, we feel that if we work together, we can get that word out even more.
This alliance wants women and men living with metastatic breast cancer to know that there's a committed group of people who want to help.
We hope that the Alliance will further the mission that we all have, and that is for everyone to know that there is a type of breast cancer that is incurable. It's called metastatic breast cancer, and we are kind of pushed to the side by the people who have primary breast cancer and are cured and live happily ever after.
The Metastatic Breast Cancer Alliance is very important to me. It means to me that I am connected with other people who understand me, and I have a support system in place.
I need this alliance because I'm gonna live 30 more years. I wanna live and see my little girl have little girls of her own. I wanna see my children blossom into the wonderful people they're gonna become. I need this alliance because I need to have hope that there's gonna be treatments for me in the future.